Hi guys, this is Diane from Treasures from Jones with another health and wellness video. This is the third video in our keto dieting series where we will attempt to answer two questions. Question number 1, can the keto low-carb diet lifestyle fight cancer and support treatment? And question number 2, is starving cancer the key to recovery? Cancer has turned into a serious disease in our modern society. While cancer was not a large factor before the 20th century, our modern diet and sedentary lifestyle has made cancer the second primary cause of death, with 600,000 Americans dying from this disease in 2020. It appears that our bodies do not react well to being exposed to daily toxins. While any cancer treatment must be guided by your physician, it's a good idea to discuss the keto diet and what it can do to help in the treatment of this disease. A cancer-specific keto diet may consist of as much as 90% fat. There's a very good reason for that. What doctors do know is that cancer cells feed off carbohydrates and sugars. This is what helps them grow and multiply in number. As we have seen, the keto diet dramatically reduces our carbohydrate and sugar consumption as our metabolism is altered. What the keto diet does is remove the food on which cancer cells feed and starves them. The result is that cancer cells may die, multiply at a slower rate, or decrease. Another reason why a keto diet is able to slow down the growth of cancer cells is that by reducing calories, cancer cells have less energy to develop and grow in the first place. Insulin also helps cells grow. Since the keto diet lowers insulin level, it slows down the growth of tumorous cells. When on the keto diet, the body produces ketones. While the body is fueled by ketones, cancerous cells are not. Therefore, a state of ketosis may help reduce the size and growth of cancer cells. One study monitored the growth of tumors in patients suffering from cancer of the digestive tract. Of those patients who received the high carbohydrate diet, tumors showed a 32.2% in growth. Patients on a keto diet showed 24.3% growth in their tumor. The difference is quite significant. Another study involved 5 patients who combined chemotherapy with a keto diet. 3 of these patients went into remission. 2 patients saw a progression of the disease when they went off the keto diet. More studies are needed, but these numbers are encouraging. The keto diet may help prevent cancer from occurring in diabetic patients in the first place. People with diabetes have a higher risk level to develop cancer due to the elevated blood sugar levels. Since the ketogenic diet is extremely effective at decreasing the levels of blood sugar, it may prevent the initial onset of cancer. From what research has discovered so far, ketogenic diet may: number 1, stop the growth of cancer cells. Number 2, help replace cancerous cells with healthy cells. Number 3, change the body's metabolism and enable the body to starve cancer cells by depriving them of needed nutrition. Number 4, by lowering the body's insulin level, the ketogenic body may prevent the onset of cancer cells. On a ketogenic diet specifically for cancer, your fat should be 75 to 90%, protein 15 to 20%, and less than 5% carbohydrates. Foods to eat include: number 1, eggs, including yolks. Number 2, all green leafy vegetables, as well as cauliflower, avocado, mushrooms, peppers, cucumbers, and tomatoes. When choosing dairy, opt for full-fat versions of cheeses, butter, sour cream, yogurt, and milk. Number 4, eat nuts such as walnuts, almonds, pumpkin seeds, hazelnuts, sunflower seeds. Foods to eat in moderation. Number 1, have 1 serving of root vegetables per day, such as yams, parsnips, carrots, turnips. Number 2, fruits contain sugar, so treat them like candy. 1 small piece per day. Number 3, a glass of dry wine, vodka, whiskey, or brandy once a week. No cocktails with sugars. Number 4, a small piece of chocolate with 75% or higher cocoa content once a week. Foods to avoid. Number 1, any food containing sugar, including cereals, soft drinks, juices, sports drinks, candies, and chocolates. Limit artificial sweeteners as much as possible. Starchy foods such as pasta, potatoes, breads, potato chips, French fries, cooking oil, and margarine. Number 3, all beers. Thank you very much for watching this video. Treasures from Jones focuses on everyday health and wellness topics that we hope you find valuable. If you like this content, please like, subscribe, comment, tell a friend, and repost. Also, please hit the notification button so that you'll know when we post episode 4 of our Keto series.